Hi everyone. This is Shazad, and you are watching my YouTube channel, Shazad from Canada. I have a question, especially for nurses who are preparing for NCLEX exam, and this question is from endocrine system. Let me first read the question for you folks, and then I will try to solve this question for you guys, and I will try to apply all those techniques that are required to do this question right. So what the question is, a nurse is caring for a patient with a history of lung cancer who was admitted for confusion, seizures, and muscle weakness. The patient's serum sodium level is 118 milliequivalent per liter, and urine osmolality is significantly increased. Which of the following interventions should the nurse anticipate? So before we go to the options, let me first highlight the keywords in the questions that can give you the clues what this condition is and how we need to approach this question. So the first thing here is I can, okay, let me use this marker here. So the keywords here are, the very first thing is a patient with history of lung cancer. This is a keyword. This word can give you a lot of um, clues along with the other keywords in the question. Who was admitted for confusion, seizures, and muscle weakness? So these are the symptoms of a disorder that we need to identify. Based on these symptoms, we need to find out what is the disorder here. So the patient's serum sodium level is, again, this is a key word here. The patient's serum sodium levels are on the lower side, and they are significantly, on the lower side, along with the urine osmolality, which is significantly increased. So all these symptoms, what do you think? What are these symptoms? These symptoms are particularly related to syndrome of inappropriate antidiuretic hormone, right? So let me just yeah, this is the condition. Based on the symptoms, I can easily say, if I have proper knowledge, if I have adequate knowledge of this condition, then I can say that these symptoms like confusion, seizures, and muscle weakness. This is common in syndrome of inappropriate antidiuretic hormone, along with the hyponatremia. Why? Because the sodium levels are significantly low. So usually what happens, like there are two sides in the pituitary. Pituitary has two components. The first one is anterior pituitary, like I'm just drawing it like this way, and the other one is the posterior pituitary, right? The interior pituitary and posterior pituitary. From interior pituitary, there are six hormones that release from anterior pituitary, and there are two hormones mm, that are released from posterior pituitary. These are and then ADH. The second name of ADH is antidiuretic hormone. Uh, yeah, this is actually antidiuretic hormone, but the other name for antidiuretic hormone is vasopressin. So uh, in normal conditions, like this is the place where the ADH releases. But in some conditions, like as we can see in this question, there is a history. The patient is presenting with the history of lung cancer. So in lung cancer, especially in small cell lung carcinoma, these cells do have the capability to release ADH in excessive amount. So if there is increased release of the ADH in body, this can cause syndrome of inappropriate antidiuretic hormone, right? Now we need to understand what's the function of antidiuretic hormone to solve this question. So antidiuretic hormone, as it is obvious from the name, antidiuretic, right? So it reduces the amount of urine, or it reduces diuresis. It controls diuresis. If the level of ADH are higher in the body, there will be less urine. If there are insufficient levels of ADH, there will be excessive urine. So there is another condition opposite to SIADH, and we call this condition as diabetes insipidus, right? So in diabetes insipidus, the symptoms are going to be opposite. Like maybe instead of hyponatremia, you can see hypernatremia. Okay, so let's move towards the options now. So first of all, what we will do, we will read the options, and we will try to eliminate the wrong options rather than going towards the right option right away. So the first option here is administer desmopressin and encourage oral fluid. Now, there is a word in the option A, which is desmopressin. Now we need to have knowledge about desmopressin. If we have adequate knowledge about desmopressin, then we can decide. Okay, so desmopressin is synthetically prepared ADH, right? So we use desmopressin in patients with the DI, not SIADH, right? Why? Because in DI there will be minimal antidiuretic hormone, so we need to give uh, antidiuretic hormone exogenously, and in patients like in craniotomy patients or in cranial surgeries where there is a condition with DA, we use desmopressin nasal spray, right? So based on our knowledge and rationale, we have decided like desmopressin, we use desmopressin in diabetes insipidus, not in SIADH. So our question asks you, which of the following interventions should the nurse anticipate, right? So this is again a keyword that which interventions the nurse should think we need to do. So based on our logic and knowledge and critical thinking, we have decided that this option is not going to work in SIADH, and this is not appropriate. So we can eliminate this option. We can cross this option. Now we have to choose our answer from the rest of the three options. So let's read the second one. The second one says restrict oral fluids and administer hypertonic saline cautiously. Okay, so in SIADH, uh, there is excess amount of fluid in the body. Due to that, there will be dilutional hyponatremia. So this value of sodium 118 is because there is excess amount of fluid in body. That's why compared to or in relative to the higher amount of water, the sodium levels are low. So that's why this is hyponatremia, and we call it dilutional hyponatremia, right? So if there is already high level or and there is more fluid in the body, we need to restrict. So Yeah, this seems a reasonable response. We can do this, and we need to administer hypertonic saline cautiously. We can do this. Why? Because the sodium levels are low, and to correct or to treat this hyponatremia, we need to give hypertonic fluids. But we can think about it based on our rational and knowledge. We can say this can be a right option, so we can keep it as a possible correct option. Then the third option is encourage increased oral fluid intake. So based on our knowledge, we have already decided that in SIADH there is more water in the body. So that's why we usually restrict oral intake rather than increasing oral intake. So we do not need to give more fluids and administer furosemide. Yes, we can give diuretics. Furosemide, this is loop diuretic. So we can use diuretics, but before we use diuretics, we need to correct this hyponatremia. All right. And so that's why we can eliminate this option as well, because we need to restrict oral fluids rather than enhancing or increasing oral fluids. The last option is administer isotonic IV fluids. Uh, based on this value, 118 sodium value, this is significantly low. We cannot correct this hyponatremia with isotonic IV fluids. Rather, we need to give hypertonic IV fluids like 3%, right? And monitor for polyuria. So polyuria is a symptom of diabetic insipidus, not SIADH. In SIADH, there will be less urine. So if there is less urine, urine will be more concentrated and urine osmolality will be high. And then opposite to that, the serum osmolality will be low. Why? Because there is excess amount of fluid, and that's why everything is diluted, right? So these were some of the options that we need to think about, and based on our sorry, based on our rationale, this answer seems right. So this one is the correct options. This is how you can choose your answer based on the knowledge, based on your critical thinking, based on techniques that we have learned, like the elimination technique. So by applying all these techniques and concepts, we can do the right job. So what's the trick for NCLEX here? This table is well-designed table which contains the information that is important to remember for your NCLEX. So you can give it NCLEX tip. You can give it a name as NCLEX tip, right? So for SIADH, if the condition is SIADH, as I said, there will be too much ADH. So this ADH increase in ADH can be because of pituitary, and this can also be if there is lung carcinoma, right? So remember, this is also a keyword here. And the serum sodium is going to be low in SIADH. Why? Because there is excess amount of water, and this will be less than 135 milliequivalent per liter. Often it would be severe hyponatremia. What will be the condition with urine osmolality? Urine osmolality will be high, like concentrated urine. Why? Because there is less urine. And urine output, as I said, there will be low urine and there will be oliguria. So how we can treat it? We need to restrict fluid, and we need to give hypertonic saline if the condition is severe. And in this case, we can see the sodium is 118, which is quite low, significantly low. So we need to give hypertonic saline, and we can also give diuretics, but first we need to correct. Uh, the hyponatremia. Here we need to remember, if we are correcting hyponatremia with hypertonic saline, like 3%, we need to correct it slowly. We need to infuse, hypertonic saline slowly rather than abruptly, correcting the uh, hyponatremia. If we'll do that, what this can cause? This can cause pontine demyelination, right? So again, this will lead to complications. So remember, we need to correct the hyponatremia slowly. The other condition which will always work against SIADH, so these two conditions are opposite. So in diabetes insipidus, there will be too little ADH, and that's why the serum sodium is going to be less, right? Sorry, serum sodium is going to be high, often greater than 145 milli equivalent per liter, and often mild. And urine osmolality will be low. Why? Because there will be diluted urine. Patients usually pass a lot of urine. I have seen patients with head injuries who are with the condition of diabetes, and whereas they usually pass 500 ml per hour, 600, and even can go up to 1000 uh, ml per hour. So that much urine they can pass. So urine output high, polyuria 5 to 20 liters per day. And then what is the treatment? We need to give them, synthetic desmopressin. We need to give them in the form of spray, and we used to give nasal spray to those patients. And then we need to replace fluid. All right, so yeah, this was all about today's question. I hope you will like the video. If you like the video, please uh, comment and also share the video. And if you are new to this channel, consider subscribing to this channel. Thank you so much for watching. Before I let you go, I would like to say, if you need any kind of help with the NCLEX exam, you can contact me. And I also provide training for NCLEX along with the English language exam. I have a team of members, and one of our members, typically deal with the English language exams, including IELTS and OET. So if you need any help with the NCLEX credentialing, NCLEX training, or international exams, feel free to contact us. Thank you so much. Bye for now.